Hi friends, today I am going to talk about cardiac events and the steps one should take before medical assistance or doctor's arrival. There are some of the signs one may notice from the person affected. Number 1, slurred speech, nausea, that is vomiting sensations, heavy compressive pain in the chest, pain radiating from the left arm, and disorientation and profuse sweating. If you find anyone with one or two of these above conditions, you are facing a person with cardiac event. You should immediately call for medical help. We all have relatives, friends, and close family members. This knowledge is meant for those who are in the age group of 30s and above. This might sound very trivial, but it is very important to equip oneself with the following information and also about cardiac events and related drugs. In the event of any such cardiac emergency, please seek immediate medical help. In the meanwhile, facilitate ECG without wasting any time at the nearest lab, and most importantly, a blood test for troponin I, which you may get within 1 hour or so as to hand over both the reports to the doctor attending and also ensure the patient is free from any physical activity like walking, moving, and violent shaking, etc. Troponin I test, the gold standard. Whenever the heart is injured, the integrity of the cardiomyocytes outer membrane, that is sarcolemma, is compromised, allowing troponin to leak out into the blood, which is a hallmark of cardiac injury. The release typically follows a biphasic pattern. Early release, cytosolic pool, a small amount, approximately 5 to 7% of troponin exits unbound in the cell's cytoplasm. This pool is released immediately upon membrane damage, becoming detectable in blood as early as 2 to 3 hours after the injury. Sustained release, that is structural pull. The majority of troponin is tightly bound to contractile apparatus, sarcomere, as the injured muscles undergo permanent damage, that is necrosis. These structural filaments slowly break down, releasing more troponin over several days. Clinical significance time frame. Levels typically peak at 12 to 48 hours, can remain elevated for 7 to 14 days. Specificity. Because the heart uses specific cardiac versions that differ from skeletal muscle versions, their presence in the blood is highly specific to heart damage. Thus, troponin complex became the important biomarker and hallmark of injury in cardiovascular events. Your cardiologist would decide as to what to do next. Here are some of the drugs used by the cardiologist. Aspirin, acetylsalicylic acid, acts primarily through the irreversible inhibition of cyclooxygenase enzymes, which disrupts the synthesis of key mediators in blood clotting and inflammation. Beyond its well-known antiplatelet effects, it also influences blood rheology, the physical properties governing the blood flow, by altering the behavior of red blood cells, that is erythrocytes, and the structure of both fibrin clots. Blood rheology and hemorrheology involves the study of blood's viscosity and deformation. Aspirin affects these properties through several biophysical mechanisms. Reduction in blood viscosity. Clinical studies have shown that regular low-dose aspirin can induce a statistically significant decrease in whole blood viscosity and yield stress. This thinning effect reduces resistance to flow in the vasculature. Blood rheology or hemorrheology involves the study of blood's viscosity and deformation. Aspirin affects these properties through several biophysical mechanisms. Reduction in blood viscosity. Clinical studies have shown that regular low-dose aspirin can induce statistically significant decrease in whole blood viscosity and yield stress. This thinning effect reduces resistance to flow in the vasculature. Clopidogrel. Mechanism of action. The active metabolite of clopidogrel binds covalently to the P2Y12 adenosine diphosphate receptor. This blockade inhibits the activation of a GP receptor complex, which is the final common pathway for platelet aggregation and fibrinogen binding. Irreversibility. Because the binding is irreversible, the antiplatelet effect persists for the entire lifespan of the platelet, approximately 7 to 10 days. Bioactivation pathway. Clopidogrel must be converted into its active thiol metabolite by the liver, primarily via the CYP2C19 enzyme. Genetic variations in this enzyme, reduction in blood viscosity. Clopidogrel treatment has been found to significantly decrease whole blood viscosity at both high and low shear rates. This reduction is linked to the drug's effectiveness in diluting the blood resistance to flow in narrowed stenosed arteries. Erythrocyte, that is the red blood cell. Dynamics. Deformability. Clinical studies indicate that clopidogrel improves the dynamic deformability index of red blood cells, RBCs, allowing them to pass through microvessels more efficiently. Aggregation. It reduces the erythrocyte aggregation index and delays sedimentation rate of RBCs. This prevents the formation of large cell clusters that can impede flow in low flow environments. Fibrin clot formation. Clopidogrel has a dose-related effect on delaying thrombin-induced platelet fibrin clot formation by interfering with the speed of thrombin generation. It contributes to a less dense, more porous thrombus structure, which may be susceptible to natural breakdown. Another drug is known as heparin. Unlike aspirin and clopidogrel, which target platelets, and heparin is an anticoagulant that acts directly on the soluble clotting factors in the plasma. Its impact on blood rheology is rapid and potent. Pharmacodynamics of heparin. Low molecular weight heparin has a shorter chains and primary inhibits factors with less effect on thrombin. Immediate onset. When given intravenously, heparin provides an almost instantaneous anticoagulant effect, making it the drug of choice for acute thrombotic events. Action on blood rheology. Heparin significantly alters the physical flow properties of blood, often more dramatically than antiplatelet agents. In plasma viscosity, heparin lowers plasma viscosity by interacting with large plasma proteins, particularly fibrinogens. By limiting the conversion of fibrinogen to fibrin, it prevents the thickening of plasma medium. Heparin primarily action is the acceleration of antithrombin, a natural enzyme inhibitor in the blood. Thanks. More to come.